Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les personnes suivantes prendront la parole de la séance d'information de cet après-midi. Le Dr. Jennifer Russell, médecin hygiéniste en chef. Le Premier ministre du Nouveau-Brunswick, l'Honorable Blaine Higgs. Speaking at this afternoon's briefing will be the following individuals: Dr. Jennifer Russell, Chief Medical Officer of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Dr. Russell.
Thanks, Bruce. Merci. Good afternoon. Bonjour à tous et à toutes. As COVID-19 rages all around us outside of the Atlantic bubble, we must make every effort to slow its spread in New Brunswick and throughout the Atlantic bubble. Yesterday, our cabinet approved recommendations to move Zone 1, which is the Moncton region, back to the orange phase of recovery. Today, I have recommended that Zone 2, which is the St. John region, also transition to the orange phase. The number of COVID-19 cases in Zone 2 has doubled in the last 2 days, with 7 new cases today. We are seeing transmission in community settings in the zone, including recreational facilities, healthcare and long-term care institutions.
Yesterday, the Cabinet approved our recommendation to move Zone 1, which is the Moncton region, back to the orange phase of recovery. Today, I have recommended that Zone 2, which is the St. John region, also transition to the orange phase. The number of COVID-19 cases in Zone 2 has doubled in the last 2 days, with 7 new cases today. We are seeing transmission in community settings in this zone, including recreational facilities, healthcare, and long-term care institutions.
Public Health has declared a COVID-19 outbreak at Shannock's Tucker Hall, an adult residential facility in St. John. Following a confirmed case of COVID-19 on Thursday, Public Health started an investigation at the facility. Contact tracing has commenced, and officials will conduct testing of the facility's residents and staff today. Although there are only 90 residents at Tucker Hall, all 422 residents and staff from the entire Parkland St. John campus are being tested today. It is vitally important that everyone in Zone 2 reduce their close contacts and follow all public health guidance. This is not the time for large public gatherings. Limit your contacts with others to a consistent group of close family and friends. Please avoid non-essential travel into or out of Zones 1 and Zone 2 that are now in the orange phase. For all New Brunswickers, I urge you to monitor your health. Even if you have the sniffles, do not assume that it's a garden variety cold. Stay at home and get tested for COVID-19. These restrictions are needed so that we can effectively manage these outbreaks and bring these zones back into the yellow phase of recovery as quickly as possible.
Today, there are 9 new cases of COVID-19 in New Brunswick. The new cases are as follows. In Zone 1, which is Moncton, there are 2 new cases. 1 individual under the age of 19, 1 individual aged 20 to 29. In Zone 2, which is St. John, there are 7 new cases, 1 individual aged 20 to 29, 3 individuals aged 40 to 49, 1 individual aged 50 to 59, 1 individual aged 60 to 69, and 1 individual aged 70 to 79 years. All these cases are currently under investigation by Public Health. We now have 51 active cases in New Brunswick, including 1 individual now in hospital. It is true that our numbers remain low in comparison to many jurisdictions in Canada, but it is no cause for complacency.
Today, there are 9 new cases of COVID-19 in New Brunswick, and the new cases are as follows. In Zone 1, which is the Moncton region, there are 2 new cases, 1 individual under the age of 19 and 1 individual aged 20 to 29. In Zone 2, which is the St. John region, there are 7 new cases, 1 individual aged 20 to 29, 3 individuals aged 40 to 49, 1 individual aged 50 to 59, 1 individual aged 60 to 69, and 1 individual aged 70 to 79. All these new cases are currently under investigation by public health. We now have 51 active cases in New Brunswick, including 1 individual now in hospital. It is true that our numbers remain low in comparison with many jurisdictions in Canada, but that is no cause for complacency. This is a virus that spreads exponentially if unchecked. Now is the time to protect our Atlantic bubble and maintain the record for which we are widely envied across Canada and around the world. And the best way for us to do this is for everyone to limit their close contacts. In zones now at the orange phase, we are directing that people limit their contacts to their single-family bubble. And that means the people that you live with. Your one household bubble includes the people that you live with. It can be extended to caregivers or an immediate family member who lives alone and requires support. The objective is to keep your circle of contacts small. There are currently about 600 people at least who are self-isolating in New Brunswick currently from different cases that have been traced in terms of contacts. And I'm sure that every single one of them wishes that they weren't at home for the next 2 weeks, and I'm sure that many of them wishes that they had not been exposed to COVID-19. We have a lot of work to do starting right now. La bulle formée d'un seul ménage.
A single-family bubble includes people with whom you live, and it can be extended to caregivers or to immediate family members who need support. The objective is to reduce your number of close contacts.
This restriction does not apply in the yellow phase zones, but I strongly recommend that everyone limit their close contacts to the greatest extent possible. And as I have said before, the best approach is to assume that everyone may have the COVID-19 virus and act accordingly. I also recommend that everyone in New Brunswick, no matter where you live, have a contingency plan ready if you are required to self-isolate. Just like EMO puts out advice around making sure you have 72 hours worth of emergency food and water, etc. if there's a power outage. You need to be prepared to self-isolate for 2 whole weeks. Make sure you know who to call on to pick up your groceries and other supplies, manage your businesses, look after your summer camp. Taking this precaution ahead of time will make the transition easier for you and those who rely on you. And I do understand that it's frustrating because I think nobody expects to be exposed to COVID-19 because we have been living relatively free of the virus in New Brunswick. So I think it is easy for people to think that we're immune to COVID-19 here in the Atlantic bubble, but we are not. So as frustrating as it is, please continue to be kind. Please continue to be compassionate. We are all doing our best. Guidance in the yellow phase zones has been changed to permit indoor gatherings of up to 20 people. Holiday parties and gatherings may proceed on this basis, but everyone should remember to keep these events to a consistent group of family and friends. Far too frequently, we have seen COVID-19 spread through contacts at casual social gatherings. I think people need to have a higher level of comfort saying no to going to these gatherings. When somebody invites you to these gatherings, please take the time to make a very conscious choice. And if you need to say no, please do so. And have a rehearsed line that you might have to bring out to practice and make sure that you're comfortable setting that boundary. This year, we must take new precautions to meet the reality of the pandemic. Holiday shopping can proceed, but with some changes. I suggest that people plan their shopping differently this year to shop during low traffic periods and avoid large crowds. Business owners can help by spacing out their sales events. And again, I want to emphasize that people should avoid non-essential travel into or out of the orange phase zones, but this holds true for the entire Atlantic bubble. I did hear that somebody was confused about what I was saying yesterday about traveling, and so when I'm talking about non-essential travel inside and outside the orange zones, that's for what we're experiencing right now in terms of dealing with these outbreaks. But in a general sense, traveling outside the Atlantic bubble or traveling outside of the Atlantic bubble for non-essential reasons or having people travel into the Atlantic bubble for non-essential reasons is discouraged at this time. Encore une fois,
again, I want to emphasize that people should avoid non-essential travel in and out of the orange phase zones.
Can be just as joyful as ever if we approach our situation with an open mind and an open heart. I also want to speak today about the processes that public health uses to alert people about possible exposure to COVID-19. And we have been asked many questions about this also. In every instance, our objective is to reach people who may have been exposed to the virus so that they can take action to slow the spread of the disease. We target our notification based on the likely opportunity of exposure. We will alert the broader public when people from a wider area may have been exposed, for instance, on an airplane or in a large shopping mall. Other examples we've seen were in an optical center, Tim Hortons, etc. Or McDonald's. So in cases where businesses' customers are more likely to be local, we may advise an owner in the course of tracing contacts, just as we would with any institution or organization. Les personnes qui font la
Our contact tracers play a vital role in slowing the spread of COVID-19, and I'm very grateful for their tireless work. It isn't always an easy job. While most people are cooperative, there are times when our contact tracing staff are treated rudely just for doing their jobs.
And sometimes organizations, businesses, etc., will put out messaging of their own, and then the public is confused about, well, it didn't come from public health, but this facility or this organization or this business has put out an alert. The alerts that you need to be aware of are the ones that public health issues. They are on our website, and those are the ones that from a public health perspective, where we are aware of contact tracing that was done, and that we were notified that through our contact tracing that there may have been people that we might have missed. If we are confident that we haven't missed people, then we won't be issuing a public exposure notice. And I want to assure New Brunswickers that our staff will continue to strive for a high standard of professionalism and care performing their duties. Even at our borders, you know, our public safety employees have been there for months and months and months, and they are doing a great job, and they will continue to do a great job. But everybody is working their hardest. Everybody is working really hard to do their best and make sure that we're protecting the population of New Brunswick, and we need everybody's cooperation. And we need everybody's compassion and patience. We are all working to prevent the spread of COVID-19 while respecting individual privacy and other rights of New Brunswickers. Thank you very much.
Bonjour. We are continuing to see an increased number of cases of COVID-19 in the province, especially today in Zone 2, the St. John region. Because of this, the All-Party Cabinet Committee on COVID-19 and Cabinet have accepted the recommendation of Public Health and have made the decision to move Zone 2 to the orange level, effective as of midnight tonight. Currently, there are approximately 300 people self-isolating in the St. John region, and this number is expected to rise. It is important to note that if we can't get the numbers under control quickly in the St. John region, we may need to move it to the red level when necessary.
I realize that there is a lot of information that was sent out yesterday with regards to the changes to the phases. The changes recommended by Public Health are aimed at finding a balance between health and safety.
Those in the orange zones, residents in Zone 1, the Moncton region, and residents in Zone 2, the St. John region, must stay within a single household bubble. A single household bubble is limited to the people who live in your house with you. Under the orange level, a single household bubble can be extended to caregivers or to an immediate family member requiring support. No informal gatherings outside of this single household bubble are permitted. Formal gatherings of up to 25 people are allowed for weddings, funerals, and faith-based services with an operational plan in place. Faith venues may hold in-person services with up to 50 participants, with 2 meters of distancing. Everyone wears a mask and no singing. Les salles à manger des restaurants peuvent demeurer.
Restaurant dining rooms can remain open, however, A single household bubble must be maintained when dining out. Personal services such as hairstylists and non-regulated health professionals may remain open, but must have an operational plan.
Entertainment venues can stay open as per their operational plan, but limiting occupancy to 50. Venues such as gyms and fitness centers are allowed to stay open as long as they are operating safely as per their operational plan, with additional mitigation strategies. Sports teams must limit their activities to practices within a single team. Les services de transport.
Public transit services can continue to operate, but passengers must keep at least 1 meter apart and wear a mask.
I know we've given out a lot of information, but if you're looking for specifics, you can go to our website, www.gnb.ca/coronavirus, and click on Recovery Plan to see what's new at each level. Throughout this pandemic, we have made changes as new information has become available, and all decisions have been made on the advice of public health. We understand that you are concerned by the increased number of cases in this province, and so are we. We share your concerns, and that is why we're asking all New Brunswickers to take what is happening seriously. We have seen areas where there have been fundraisers, social events, household, and other gatherings with way too many people, no social distancing, and no face masks. Too often, people are gathering with one group at one night and completely a different group another night. This has led to the situation we are currently in, and we need to take responsibility for that. I'm calling on all businesses, especially the ones where people gather, such as restaurants, bars, coffee shops, cinemas, and shopping venues, to do everything they can to follow the directions of public health. It's important that we continue to keep businesses open wherever possible, but in order to be able to do that, we need to be sure that the protocols are being followed and a plan is in place that keeps patrons safe. We also want to encourage patrons. We want to encourage people to support local businesses because it's important. It's important for our economy. It's important that we continue to operate as normally as possible. But we cannot do so when mass gatherings are threatening us moving tighter and tighter controls in order to push back and keep our curve flattened. We want to be able to return to both Zone 1 in Moncton region and Zone 2 in the St. John region. We want to return to yellow level as soon as possible. C'est notre but.
It is our constant goal to allow people to go back to the yellow phase while protecting their health and safety, and this until a vaccine would be widely available.
We need to do everything within our power to ensure that no other regions have to move to orange level, or that any regions move to red level in the coming days. Each of you have an important role to play in that. In fact, I can't stress this enough. It is the actions taken on the individual level that will make all the difference in how well we stay ahead of this pandemic. It is important
that we all make an effort to limit our numbers of close contacts as much as possible.
The holidays are approaching quickly, and this year, as heartbreaking as it may be, we must limit our gatherings and keep our contact numbers as low as possible. This is also important advice to keep in mind in the lead up to the season as holiday shopping ramps up. Black Friday is coming up next week, and under normal circumstances, this would be an opportunity for stores to offer big one-day sales. It is crucial that we continue to reopen our economy, but we cannot risk the health of New Brunswick in doing so. But I also want to encourage business owners to spread out their sales if possible to avoid large numbers of customers shopping on a single day. I also want shoppers to continue to enjoy the shopping event in a health and new safety way. It's important that we support our local businesses, but we can do that in a way that ensures that we maintain our health standards, we flatten the curve, and we also keep our economy and our businesses open.
I want to encourage shoppers to spread out their shopping when they can. Avoid peak hours and come back later if a store is crowded. And check if the products are available online.
We must all continue to follow safety guidelines like wearing a mask and maintaining 2 meters of physical distance from others when we're in public. It's not one or the other. Do both to increase our defenses against the virus. De nombreuses entreprises.
Many businesses have done an excellent job of posting signage, such as arrows, to ensure customers avoid contact as much as possible. Please pay attention to these signs and follow the rules.
The best way to protect yourself and everyone around you. We're going to see more cases of COVID-19 in the coming days, but we want to be able to manage these cases so we don't overwhelm our hospitals and our health professionals. While increased cases is expected, we must continue to do everything we can to slow the spread of the virus. It is imperative that we continue to work together to keep each other safe and to move our entire province back to yellow as quickly as possible. We can do this. Think about what you were doing last week. Think about what you've been doing in the last few weeks. And think about how that impacts the health of yourself or the health of others. And were you doing your part to protect the health? I've said it many times here before. This isn't about being able to enforce these rules. This is about everyone understanding the rules, being part of the solution to ensure that we have a healthy and safe Christmas season, and we move safely into the time when a vaccine is available. Thank you. Merci.
Merci beaucoup, Monsieur le Premier ministre. Dr. Russell, thank you, Premier. Thank you, Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. Chaque journaliste peut poser une question. We'll now proceed with questions from members of the media. You have the right to pose your question in the language of your choice, and each reporter will have one question today. Natalie Sturgeon, Telegraph-Journal.
Thanks, Bruce. My question is for Dr. Russell. You declared an outbreak at Tucker Hall at the Shannock Parkland St. John, and I'm just wondering whether that case is connected to a medical professional, and of those 300 people that are now self-isolating, how many of those are medical professionals?
I don't have exact numbers on how many are healthcare workers, and I can't speak to whether the person who tested positive at the Shannocks is a healthcare worker or a staff member, or a resident, rather.
Okay. Thank you. Savannah Odd, Telegraph-Journal.
Hi there. My question is for the Premier. Today, we saw a bit of an interruption in the sitting in the legislature, and we're told that it was discussed, I guess, what will happen next week in terms of, how people will sit. Will it be virtual? Will it be hybrid? Leaders are telling us they don't know the answer to that question. There seems to be a lot of confusion. Is there a plan for what is going to happen with the legislature? Is there a contingency plan if we continue to see these outbreaks? And I guess, what is the plan for next week?
So right now we have I guess the one consideration is in relation to the public health requirements that that we would be staying in the zones that are affected, the orange zones. And particularly now we have 2. So that will limit the number of people that would actually be coming to the legislature. However, the legislature can continue to operate with a reduced number of MLAs actually present who are living or staying outside of the affected zones. So that is a debate that's underway right now in order to determine if the Speaker will allow the ledge to remain open under reduced numbers and feel that they can do that safely, meeting the health rules, which I would guess that will be permitted because we were operating before under the health rules with a larger number. The option, the only other 2 options aside from running with reduced staff and reduce the MLA participation, which we can to meet quorum, would be to suspend the House for the next couple of weeks until we see what happens in these zones. We are not equipped to run the House virtually at this point, and that will be a decision with LAC. There hasn't been any proposals made to put it into that sort of a position like the federal government is at this stage. And I don't know if any other provinces are doing that at this point either. However, if this becomes a prolonged issue, then that has to be an option which the legislature will consider, and I would say make a proposal to the government, and we would be making some modifications to our capabilities.
Thank you, Premier. Thank you, Ms. Ott. Pascal Rochnog, l'Acadie Nouvelle.
Acadie Nouvelle. Hello. My question is for Dr. Russell. Inaudible. The question is about how close St. John would be to entering the red phase. For the outbreaks that we've already experienced in Zone 5 and the past outbreaks in Zone 1, the trigger points were the doubling of cases within a given number of days and outbreaks in areas with vulnerable populations. So those were the 2 trigger factors. The fact that we don't have cooperation from all members of the public with regards to wearing masks in public areas or in less safe public gatherings, and with recommendations with reporting names and phone numbers and restaurants, this makes contact tracing difficult, especially when there are outbreaks that affect places like those. Another trigger is something that we're following closely. There was a question about healthcare workers being implicated. Yes, there were public healthcare workers in Zone 2 and in Zone 1 that were affected. So we will monitor the situation to see if there are more triggers in this category and see if that affects the number of people that will have to be hospitalized, for example. The one thing that's concerning now is the number of healthcare workers that are involved. Will any of them pose a challenge with regards to offering health care in the next days and weeks? If someone is not positive but is in self-isolation, that means that they cannot provide health care services. So we will continue to analyze the situation, and if necessary, we will have to go to the red phase. But we will only do this after we have the information to motivate that kind of decision.
Thank you, Bruce. My question is for the Premier. Premier Higgs,
just to clarify from yesterday, is it now mandatory for Campobello Island residents to who get gas or essentials in the United States to isolate for 14 days? If so, what motivated that change? And are you aware that St. Stephen is over 80 kilometers away from the island?
Yes, I'm quite aware of the distance. It's been that same distance for a lot of years. The idea of no, there's nothing's changed in terms of their movement into Maine and back. We want them to be as normal as they were before. That's the goal. And I asked, as I said yesterday, is how do we ensure that life is the same and or as similar? We are encouraging, however, that they would minimize any stops in Maine and go directly through to St. Stephen or back. That would be the safest thing to do, and I have asked our public safety folks to work with border guards and officials, so we do have continuity there of what's being offered, and if I find some, let's say, situations that we can't manage or haven't been managed properly, then we will work with the residents and the officials to fix that, to remedy that.
Thank you, Premier. Thank you, Ms. Hogarth. Nicolas Steinbach.
Nicolas Steinbach.
Global News.
Thanks, Bruce. My question is for Dr. Russell. Doctor, I've seen a lot of people voice concern about the single household bubble, but be able to go to a bar and see their neighbors from a distance. How are the decisions made to keep what seems to be all businesses open while tightening the household requirements?
Well, what we're seeing in terms of the transmission patterns is people who are gathering, whether it's in a home or whether it's in a private function, we are seeing the transmission patterns mostly outside of these types of settings. So, and in the cases where transmission has happened in that type of setting, again, if we're able to trace the close contacts, then at this point in time, that is what we are doing. And when we can't do that, then we issue public notices about possible exposures. But again, we take the information and we analyze it, and we are constantly revising our approach and constantly revising our phases to reflect the risks, to reflect the information that we receive around transmission patterns in the province.
Thank you, Doctor. Thank you, Mr. Smith. Geneviève Normand, Radio Canada.
Geneviève Normand, Radio-Canada.
Yes, my question is for Premier Higgs. Next week, it's going to be 8 months since the closure of the borders, and I was wondering if you are satisfied the way things are as of right now.
So I'm not sure I understand the question.
Yeah, of course. So it's been 8 months since the borders were closed, and I was wondering if you are satisfied with the measures that are in place to limit the spread of COVID-19, and in fact, if you think the borders should remain closed for a number of months still.
Oh yes, I do indeed think the border should remain closed, and we continue the diligence there that we have been, and strengthen it wherever we can in that sense. I guess what we are seeing is what is having an ongoing impact is the regular travel for essential service and employment that is happening routinely, and that's why changes were made here this week in relation, and in the past weeks, in relation to the testing of travelers, because we were still finding that activity in the community was still there, and despite the timelines for isolation were not hadn't gone the 10 to 14 days. So the border controls need to remain. The U.S. border connection and the way that that's being managed with the federal government in terms of its enforcement needs to stay. And we're heightening up our testing in order to protect against those that we know are traveling and make it ensure that they remain safe when they get home and don't transmit the virus to anyone else.
Thank you. Merci beaucoup, Mademoiselle Normand. Dr. Russell, Callum, are you still there? Dr. Russell has some more information for you.
That'd be great.
Hi, sorry. The answer to that question is actually in restaurants and those types of situations, in the orange phase, you're not actually allowed to go to those establishments and sit with anybody but the people in your household bubble. So your question around going to a pub or a restaurant and meeting your friends, etc., that's not okay in the orange phase. You can only be seated with your household bubble members.
Thank you, Doctor. Thank you, Mr. Smith. Adam Harris, Telegraph Journal.
Thanks, Bruce. To both the Premier and Dr. Russell, roughly 25% of New Brunswick's COVID cases are New Brunswickers who traveled outside of Canada and brought the virus back. Yet New Brunswick still has a lot of snowbirds contemplating a trip south. I was hoping you could address them today. Should they go? If they do, what should they know? And are you working on any different requirements for their eventual return?
The Premier may have a different answer than I have, so he may want to comment after I do. Without question, a pandemic is not the time to make any non-essential travel plans, period. That is my answer.
So since we, continue to tag team in our communication, and we're certainly been fully aligned here, I would certainly concur that if we were looking at where's the safest place to be, I don't think I'd pick Florida or the South. And so right now I would discourage if someone was planning to go south, I might hold off on that just a little longer and wait for a vaccine.
Thank you, Mr. Harris. Laura Lyle, CTV.
Hi, my question is for Dr. Russell. Dr. Russell, at what point would you consider doing mass testing in the St. John region and the Moncton region?
Well, we are having conversations right now about making sure that we have capacity to meet the demand as it is right now. In other outbreak situations, we have done mass testing. For the time being, we're doing the mass testing in the Shanix Parkland Estates facility. And if there is any other involved institutions, then we'll be doing testing in those types of areas. But the conversations are ongoing about what other opportunities that people will have to get tested. But at this moment in time, if anybody has any one of the symptoms on the list, they can call 811 or they can do the online assessment form and get tested at this moment in time.
Thank you, Ms. Lyle. Thank you, Dr. Bobby Jean McKinnon, CBC.
Yes, thank you. My question is for Dr. Russell. I think you might have covered this a bit with Luckady and Nubel's question, but putting St. John back to the orange level may seem extreme to some people when there are only 14 cases right now. Moncton had 24 cases before you bumped it back to orange yesterday and 21 before you bumped it back to orange in October. Can you just please explain why you're taking this step now?
The contact tracing has revealed that some of the spread is happening in areas, number one, where there is a super spreader event, and there are some super spreaders involved in some of the cases. So we are expecting more cases to pop up, and the fact that there are so many healthcare workers involved at this moment in time who are self-isolating. And again, with the contact tracing that we've done and the type of contacts that we have found and those people who are self-isolating as a result, we expect many of them to become positive. But in terms of the triggers have been met. So the triggers are doubling time within a 6-day period, and that has happened. The other trigger is the number of healthcare workers that are affected currently. And the other is the fact that people have not been following public health protocols and advice around physical distancing, keeping their close contact numbers low, wearing their masks, etc. So we are seeing all the triggers that we used in the Zone 5 outbreak, in the Zone 1 outbreak. They're quite similar with the exception of again, the impact on the healthcare workers. The fact that in St. John, a very large nursing home is involved at this point in time and doing all that contact tracing and testing at this moment in time. Again, there's a huge risk there, so vulnerable population being affected is one of the triggers. So the triggers haven't changed. The criteria have been met to move to orange in the Zone 2.
Thank you, you, Doctor. Thank you, Ms. McKinnon. Sophie Deshôtels, Radio-Canada.
Sophie Deshôtels, Radio-Canada. My question is for Dr. Russell. Many people have asked us, why are we reducing the bubble to a single household while kids are still going to school and have multiple contacts there? They can still do school sports, and then they bring those contacts home. I understand the question. We're trying to reduce risk. We can't reduce the risk to zero. We want kids to be able to go to school. It's so important. In all of our conversations with the other chief medical officers in the other provinces, show us that everyone agrees. It's very important to make sure that kids can go to school. We don't want to change that. The risks are reduced as low as possible in schools. With regards to gatherings, people who spend time with others outside of their home is not absolutely necessary unless someone takes care of someone else. We're trying to reduce risk as much as possible. The goal is to protect our businesses, to protect our schools, our hospitals, and our healthcare workers.
Merci, Mademoiselle Deshôtels. Inda NTR, Huddle.
Hi, this is a question for the Premier. Premier, there's two zones in New Brunswick that's in orange, and Nova Scotia is also experiencing community spread. So I was wondering how soon could we see changes to the Atlantic bubble?
Well, certainly I dare say the public health officials internally have been discussing. I know I've had some conversations with Premier King in relation to what they're doing there in PEI. At this stage of the game, it would more likely be PEI who would look at, if they should reinforce their borders, and as we're experiencing similar situations in Nova Scotia and New Brunswick. Newfoundland's seen a bit of an increase as well. So we haven't had any discussions about the bubble changing at this phase, but I would anticipate you'd see some maybe minor tweaking within the individual provinces on border controls. And doesn't necessarily change the whole bubble, but it likely will cause some strengthening at individual borders.
Thank you, Premier. Thank you, Linda. Thank you. François Leblanc.
François Leblanc, Radio-Canada. My question is for Dr. Russell. There are organizations in St. John. I didn't hear the question. Can you repeat the question? A member of the St. John Sea Dogs updated people about personnel that was infected with COVID. What's interesting is that in the message, they said that the person on staff had a test last week. If you look at the games, they played against Bathurst, Moncton, Halifax. So we would like to know what the risks are with regards to infection. Are you going to ask the league to stop their activities? Will you speak to the league? I can't comment on individual cases. But if a situation changes and the risk factors change, there was a conversation today with the hockey organizations, and last time I spoke with my chief medical officer colleagues in Nova Scotia and Prince Edward Island, we saw that the risks were increasing. So we discussed whether or not teams should be allowed to travel between provinces to play games. We didn't arrive at a decision. It's something we discussed because of increased risk.
Ali, Tribune.
Thanks, Bruce. This question is for the Premier. Under the previous orange phase, hairdressers, barbers, tattoo shops were forced to close. I'm just wondering, when were the changes made to allow for these businesses to remain open in the orange phase, and will they be, well, I guess that's...
Hi, I'm going to take that question. So our phases have been continually revised based on what we're seeing in terms of transmission patterns, evidence, and data. So, so our original phases with respect to red, orange, yellow were a certain set of protocols, and then we revised them in the summer. And then prior to the outbreak in Zone 5, we had planned to do another revision, but obviously got sidetracked by the outbreak. But we certainly had made the plan to change the phases again based on risk, based on evidence, based on changes and the evolution of the pandemic, so we could reflect the correct and targeted mitigation for the risks that we were seeing as things have evolved. So, and we will continue to do that. So there could be more changes in the future. But at the time that the outbreak happened in Zone 5, again, we're always continuously looking at revising all of the information in those phases.
Thank you, Mr. McNally. Marie Sutherland, CBC.
Hi, yes, good afternoon. My question's for Premier Higgs. Prime Minister Trudeau today urged Canadians to follow public health rules to contain the spike in COVID-19 cases. And you've also made it very clear today that individuals have to do their part. And you've seen cases of people not following public health protocols. So I'm wondering, given this rising threat, is it enough to ask people to take preventative measures? Will you be increasing monitoring in orange zones, increasing fines and penalties in these zones for people who don't abide by the rules?
Yes, and I think in all counts, we have to continue the monitoring, and we have to really go after the major infractions. I mean, if there's a dinner party with 100 people, that's a major infraction. And I think, you know, while you say, how do you manage with so many people violating the rules, you know, it is a time that we are asking people to really look at their behavior. And I know it's difficult, and I know it's frustrating, but we're so close. So we will be monitoring more, and we will issue fines and if necessary. But, you know, my point has always been, we can never hope that we're going to catch anybody, and no one should feel like they won something because they actually beat the rules. Because I am sure you know, in this case and the way that the transmission has happened in the St. John area over this last several days, no one should feel good about that. No one does, I'm sure. But at the time, it didn't seem like it was an issue. Well, it is an issue, and we'll never catch everyone, nor will we try. But we really want people to pay attention and help us here, because the health system is at risk, and keeping people safe is at risk, and lives are at risk.
Thank you, Premier. Thank you, Ms. Sutherland. Erica Butler, CMHA, Sackville.
Thank you, Bruce. So, like my colleagues, and I apologize if this sounds like it's echoing some of the other questions, but I'm hearing from people concerned that the new orange has tightened up on the household bubble, going from 2 households to 1, and then at the same time loosened up on business and recreation settings. So I'm wondering if you can break down some of the numbers that might help explain the rationale behind that. Like how many cases are coming from informal gatherings with friends and family versus how many are coming from settings like retail shops and restaurants?
I actually have some information on that, Erica. And again, throughout the pandemic, we've always been trying to reduce risks as much as possible. In a pandemic with a virus like COVID-19, the risk will never be zero. And protecting people's mental health, protecting people's businesses, protecting the schools, the economy, and the hospital workers and the hospital capacity, so that people can not only get treated for COVID if they have COVID, but they can also get treated for other things, because we do have an elderly population here. We do have a lot of people with chronic diseases, and they need treatment. They need elective surgery, urgent surgery, et cetera. And when the healthcare system is overwhelmed, we can't continue with offering those types of services. So what we're seeing in terms of the types of outbreaks and transmission in the various types of outbreaks that we've seen so far, many, 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 many of them are as a result of people gathering in private places for private functions. Informal gatherings of any kind have contributed to a lot of the transmission. With respect to businesses, I know for a fact that there have not been a lot of scenarios where transmission has happened in businesses, et cetera. That doesn't mean to say that we might not still see a lot of that type of transmission in the future. Certainly, my understanding from the Department of Public Safety is when they've been doing inspections about people wearing masks, they've had quite a good compliance with mask wearing. But prior to the outbreak in Zone 5, that wasn't the case, and that's why we've made changes around mask wearing. We know how important that is because we were seeing transmission in workplace settings between employees, not when they were working with the public. When they were working with the public, everybody was following the public health guidance. But when they were working with each other away from the public or where they were having lunch breaks, et cetera, that is when we were seeing transmission. We are also seeing transmission for people who work in different types of settings who are going to work with symptoms and not getting tested. So we know that's a problem. So we're trying to address that as well, again, with messaging around making sure you get tested even if you have mild symptoms. So with respect to Region 1 and Region 2, I do have all of the outbreak patterns of transmission. There are still some cases related to travel outside of the Atlantic bubble and international travel as well. But most of them I'm seeing are private gatherings at this point in time, and so that is why it is so important that we limit our close contacts. When we talk about doubling time, and there was one reporter who asked a question about, well, it was only 14 cases, and why is that such a big deal? Well, exponential growth in cases is very dangerous in terms of the effect that it can have in a very short time on the healthcare system. For example, in the outbreak in Zone 5, there were upwards of about 80-plus cases, but when you did the breakdown of what percentage of that population would need to be hospitalized and what percentage of that population would need ICU care, you can break down what those percentages are, and you can model what the hospital capacity will be and how many cases it will take to actually overwhelm the system. And it's surprising how fast that can happen. It can happen in a matter of days. So we don't have the luxury of messing around. We don't have the luxury of waiting. We don't have the luxury of taking our time and humming and hawing. We have our triggers. They're there for a reason because it is very, very, very important that we, again, protect our healthcare system from becoming overwhelmed, and it can happen in a very, very fast time frame. So if we have 14 cases today and they double, that's 28 tomorrow. And let's round that to 30 because it makes the math easier. And then if that doubles again, that's 60. And if that doubles again, that's 120. And if it doubles again, it's 240. And if it doubles again, it's, you're up to 500 cases in a very short time. Well, we know the breakdown of that 500 would be 20% will be very ill. 15% will require hospitalization, 5% will need ICU care, and a certain percentage of those will pass away. So we know the math, we know the modeling, and we know how important it is that everybody do what they need to do immediately to get this under control so we can go back to the yellow phase as soon as possible.
Thank you. Thank you, Doctor. Thank you. Isabelle Legier, CBC.
Hi, yes, question is for the Premier. What happens to people who are being evicted in regions that are at the orange and red level? Does the government have plans to protect tenants from having to find new places to live when they're supposed to be staying at home?
So your question was what happens if it's at the orange level and they're evicted?
Yes.
And we have cases, we have situations where that is happening?
If there's any guidelines in place for the government to protect these tenants, if that were to happen?
Well, right now, we had at the beginning here, we had when people were losing their jobs, when people were not able to pay their rent, we had mechanisms in place. So I'm not familiar with cases where because a situation where we've gone to a different zone. That's why, we're trying to keep schools going, we're trying to keep businesses open, so people's employment continues, and the health rules continue to be followed, but yet their economic activity continues. And that's what was different at the very beginning of the pandemic. So right now, I'm not familiar that because of going to orange, we're going to see any significant changes in certainly evictions within apartments.
Can I correct that? Sorry.
Sure.
Within the orange phase, as people are supposed to be staying home, is there any way, not necessarily that this would cause evictions, but if an eviction were to happen in this phase, is there any policy or guidelines set in place by the government to protect those tenants?
No, not at this time. That would particularly related to a situation, but I'm not sure why that would cause an eviction. There would be other circumstances causing that eviction. It wouldn't be related to it being an orange phase, and so I don't believe there'd be anything in place at this stage that would change that as a situation.
Thank you, Isabel. Tom Bateman, Times and Transcript.
Good afternoon. I've got a question about the communication of the protocol related to COVID-19. Premier, you noted that there's a lot of information about the measures that people, especially in zones 1 and 2, need to take. Some of it's changing. We heard today from other political leaders who think there needs to be, a more comprehensive communications plan, perhaps consideration given to people who don't have internet or Rogers TV that would allow them to watch these briefings. Are you monitoring how well New Brunswickers are understanding what you're asking them to do? And do you think that there's any changes required to how these requests are being communicated?
Well, actually, the polling that we'd previously done, the communications and the effectiveness of it were received very, very well. I mean, we're up in the 90s, I think, even. So I don't have a recent stat on that, but I think overall it has been received quite well and accepted around the province that the message is understood. I think of late, though, to your point, some of the cases where we've had to move back and forth from a yellow into orange, and probably of the most recent, like yesterday, in the case of, in the last few days, maybe even announcing that some of the changes had made in orange. So in other words, we're allowing hair salons to stay open. Well, in the past, that wasn't there. We're allowing some businesses to keep running, but all of them have had an experience now with COVID. They've had protocols set up that have been approved in their operational plan. And so that gives us the flexibility to kind of evolve as they have evolved. And so managing the risks becomes different now than it was when we first started back in March. So I think there may have been a little confusion this last few days about how the colors had changed a little with different things, and I could use those examples. But overall, I'm not. It's very clear on the website, and we're also putting out different informations. I have had suggestions that we could put out different alerts, maybe in print, so that if something changed dramatically, it could be an alert function, and then we're looking at that. I'd like to think we're going to see less of this and more, but unfortunately, the last few weeks haven't borne that to be a reality.
Thank you, Premier. Thank you, Mr. Bateman.
Sorry, I have something else to add to that. So you raise a really good point, Tom, and we have actually learned through the outbreak up in Zone 5, we are now doing community engagements with MLAs and mayors of the different places where we have to change phases. And when we did our engagement session up in the Zone 5, what we learned is that you're right, there are people who don't have internet. And so in that particular case, because we had imposed the orange phase protocols, and they still weren't quite, we weren't seeing it reflected in the transmission patterns in terms of changes, and we weren't seeing it reflected in the case numbers. So we were taking extra steps to find out what else needed to be done for communication. So we did quite a blitz with respect to local media, and also some printed materials for that community. And then our last community engagement session that was done in person was down in St. Stephen. And again, when you're engaging the community leaders, they know their population very well. And so we're accessible to those leaders, whether they're MLAs or mayors, to be able to find out what their needs are and stay connected that way. We, and then with respect to this recent the issue for today with Zone 2, we also have had conversations with the community leaders to let them know what was happening. And we do have, in conjunction with public safety, we do have some more community engagement sessions planned for around the province in different communities. So I do hear what you're saying, and it is really important that everybody understand that not everybody hears information in the same way. The targeted audiences are different age groups, and so in the Zone 5 outbreak, there certainly were many elderly people involved who would not have access to internet and things like that. So the printed material was really important. The radio, local media interviews, et cetera, and local newspapers, et cetera, was really important and key. And we keep learning from these situations, and we'll keep taking that information into account. But again, I think that the engagement with community leaders in terms of understanding how it is that we can help them help their communities in outbreak situations and get back to the yellow phase as quickly as possible.
Doctor. François-Pierre.
François-Pierre Dupeau, Radio-Canada. My question is for Dr. Russell. In Zone 1 or 2, St. John or Moncton, were there large gatherings with young adults or teenagers? Are gatherings like these worrisome? Should they have been fined? And did they affect the return to the orange phase? There are many factors involved in an outbreak. It's not just a single thing that happens. So maybe there was a small gathering, and then another gathering, and then another gathering. That's what happened in Zone 5. It was many small gatherings, but at the end of the day, there were 80 cases that were involved in Zones 1 and 2. It's a culmination of many factors, but gatherings pose the largest risk at this time. That's the most important message today. Gatherings are such a risk factor, and we don't want it. If we had gatherings this summer, things were going well. Other provinces around us had good situations too. Our numbers were low. But the problem now is that we never told the public there was no risk. We never said the Atlantic bubble would have zero risk. The risk is higher now because all around us in Maine, in the United States, in the other Canadian provinces, Manitoba, Saskatchewan, Quebec, Ontario, Alberta, British Columbia, there's not a single province in Canada that isn't seeing record numbers of cases, record numbers of people in hospital, record numbers of deaths. And we're expecting 60,000 new cases per day between now and the end of the year. Worldwide cases and deaths are beating records every day. It's incredible. So the risks outside of the Atlantic bubble are so high that it's impossible to bring the risk to zero in our province, in our bubble. That's why we have to reduce our risk by reducing our bubble sizes, the number of people we come into contact with. It's so very important at this time. We're not in an easily managed situation, especially if our hospitals are overwhelmed and can't manage the number of cases. That's why these messages are so important. We need the public to understand that it's important to follow public health guidelines at this time.
Miramichi Leader.
Hi, my question is for the Premier. I'm wondering if you're aware of the petition that was recently launched by the MB Coalition for Pay Equity, asking for increased funding for transition home workers who were deemed essential during the pandemic. And if you plan to increase their wages or further funding, and if not, can you explain the reasoning behind that?
Actually, we have a plan that was identified a year or more ago in relation to improving the wage levels, and that was our focus for home care workers and daycare workers to to raise their wages up, and I think the target is for $19 an hour, and that's been on our radar right from the very beginning.
And specifically, I'm looking at the transition home workers. That's who this petition is asking for a pay increase for.
The transition. So what area of workers?
The transition home workers.
Yeah, I would think that they would certainly be in the same situation, but I haven't looked at that directly at this time, so we will understand that further.
Thank you, Ms. Woodard. That concludes today's update. Ça conclut la séance d'aujourd'hui. Merci beaucoup. Thank you.